Well, welcome to our patients and families in attendance. And this is one now of several of our patient and family forums that we've been holding for Smilow Cancer Hospital and Yale Cancer Center. And really, it's an effort that we started, I believe, in early April to keep all of you informed about what's going on in the Cancer Center, how we're addressing this pandemic, how we're staying steadfast to the mission of discovery, compassionate expert care, and making sure that our patients and their families get nothing but the best possible cancer care imaginable. And my name is Dr. Charles Fuchs, and I'm the physician in chief of Smilow Cancer Hospital and the director of the Yale Cancer Center. And really appreciate you making the time to join us for our forum this evening. And I'll introduce people by name if you want to wave when I call you. So joining us today is Kim Slusser. Kim is the vice president for patient services at Smilow and also our chief nursing officer. We'll be joined by Kevin Billingsley, who I think is en route, who's our chief medical officer. Javier Alvarado, who is the system director for social work for Yale New Haven Health. Nancy DiRienzo, who is a nurse working in our melanoma surgical unit. Dr. Christy Gomez, who's a member of our faculty, assistant professor of medicine, working at Torrington and an expert, among other things, in gastrointestinal oncology. Dr. Kelsey Martin, who is also an assistant professor of medicine, working in our Orange Care Center and with expertise in hematologic malignancies and hematology. Paula Pike, who is a clinical program manager for our network. And finally, Dr. James Yu, who is a professor of therapeutic radiology with expertise in a variety of things, including novel technologies and genitourinary and central nervous system cancers. And, you know, our agenda is I was going to run through some items. I will say we got, oh, great. And finally, Dr. Kevin Billingsley, our chief medical officer, just joined us. So we have the full complement of experts. And I'm so pleased that I'm joined with such a group of talent who span disciplines as part of our effort at Smilow. So the agenda will be, we'll have a few short presentations. We've gotten a number of questions already in advance, but we really encourage people to submit questions on the Q&A and chat lines, and we'll get to as many as possible. So let me start with a little background. And Renee, if you want to bring up the first slide. Thank you, Renee. So if you want to just, next slide, please. So as our agenda will be Kim and Kevin will, Dr. Billingsley, and will share with us some updates on our clinical operations and obviously be available for your questions. Javier will talk to us a little bit from the perspective of social work about how we can care for each other and cope with what can be challenging times. And then our entire panel will be available for questions. So next slide, please, Renee. So, you know, just background that you know, but I never want to take for granted. You know, we're really very fortunate to work at a place like the Yale Cancer Center and Smilow Cancer Hospital, which has really a century-long, if not longer, history of leading research in cancer therapeutics. In fact, chemotherapy was essentially started in many respects in the early 1940s by investigators at Yale. Next slide. One very important feature is the War on Cancer Act of the early 1970s designated across the United States these entities which are National Cancer Institute designated comprehensive cancer centers, where basically you are the center for your region. And as part of that original designation in the 70s, Yale was the designated center for this region of New England and the entire state of Connecticut, and a designation which we continue to be privileged with today. Next slide. A landmark event was the opening of Smilow Cancer Hospital, where I'm sitting at the moment, 15-story building dedicated to expert clinical care and research. Um, next slide. In 2016, we opened a state-of-the-art experimental therapeutics unit next door to Smilow, so that we have the ability for delivering to patients really cutting-edge new therapies that we think are moving the field. Today, we have more than 450 physicians and scientists. We now have care centers where our faculty and outstanding staff work across Connecticut and Rhode Island, where each of them is dedicated to being a destination expert center. Next slide. And by the way, we have to renew that designation. We have to compete for it every 5 years. We've been successful. And frankly, in this last review in 2018, we were praised by the National Cancer Institute for being one of their truly outstanding centers. Next slide. And this is our network. As I say, beyond our center in New Haven, where I'm sitting at the moment, we have centers really across the region, and many of the folks on the call today represent those centers. And it really is our commitment to providing world-class expert care to every community, so that no patient ideally should have to travel more than 30 minutes to get access to world-class care, important access to novel therapies and clinical trials, among other things. Next slide. The other key element of this is when a patient and a family are dealing with cancer, they want to see the expert. And that's one of the great things about our center. We have expertise across this range of cancer types, and we are continuing to expand our pool of talent beyond what we have. And I think many of our faculty here and our staff nurses here today can speak to that expertise. Next slide. The other aspect is, because we are a National Cancer Institute designated center where we have labs that are focused on discovery of new targets, new therapies, we are committed to moving those discoveries in the lab to the clinic. And next slide. We really had a very productive year this year, 2020, which is cutting edge studies that define new treatments for colon cancer, head and neck cancer, bladder cancer, genitourinary cancer, prostate cancer, lung cancer, among others. And next slide. What is really incredible is that an unprecedented feat, which is this year, studies by the Yale Cancer Center and Smilow Cancer Hospital will have led to 4 new drug approvals with the Food and Drug Administration. In any good year, if you're lucky, if you have 1 or 0 for a cancer center, to have 4 in a year is just reflective of the sheer talent we have here. Next slide. So we can't overlook the fact that we're obviously dealing with a pandemic, and I'm so proud of the leaders on this call with me who have taken charge of making sure that our patients got the care they needed, that it was safe, that our staff were safe, that we always could expand the capacity to provide care to patients. And most importantly, our researchers not only continued their work in cancer research and developing new cancer treatments, they actually led the charge on treatments for COVID, which have been sort of landmark publications this year that I think the field is greatly benefiting from. Next slide. So it's been a tough haul, and I'm not going to deny the fact for all of us living in these circumstances has been challenging, including doing this event by Zoom. But hope and vaccines are now on the way. The news is full of the stories of these. And I wanted to spend, because a lot of the questions relate to the vaccine, I did want to share some brief background on this. So next slide. So there are a number of vaccines that are under development. The 2 that are farthest along, which are likely to be approved by the Food and Drug Administration this week or next, are the ones by Pfizer and Moderna, which are so-called RNA vaccines. So how do RNA vaccines work? So next slide. What RNA is a piece of genetic code that encodes a protein. And so what these vaccines do is they take this little piece of code, which codes a piece of the COVID-19 virus called the spike protein, and puts it in a lipid or a fat particle. And then that code is packaged into the vaccine, which next slide is next slide, Renee, is injected into your arm, such that, next slide, that little coding particle goes into a cell in your arm, where it then produces that spike protein, that protein that the virus normally makes, but you don't have the virus in you. You just have that little protein. And what that protein does, next slide, is it elicits an immune response. So antibodies and immune cells now recognize the protein, even though you never got infected with the virus, such that, next slide, when you actually are exposed to the virus, your immune system already recognizes it and destroys it so that you don't get sick. And I want to be clear that this little piece of RNA gets destroyed almost immediately in your cells, so there's no lingering effect of the genetic code in your body. It's perfectly safe. And what do we know about these two vaccines with studies of over 70,000 individuals? Is they're safe, and they appear to be 95% effective. And this, I think, is a game changer into what our lives will be. The next vaccine that you'll hear about is one by AstraZeneca and Oxford, which essentially is, in this case, a modified virus that also contains this capsid protein. And when given with the vaccine, the virus, the capsid protein from the modified virus, which is an inert virus, elicits an immune response. And that too seems to be effective, although not quite as far along as the current vaccines from Pfizer and Moderna. What we suspect is that we will start to get shipments of this vaccine within the next week or two. The first phase of the vaccine will be administered to healthcare workers, those people working on the front line. And what we anticipate happening after that is that it'll be available to patients. How that will happen and when that happen, and there's a lot of questions that came in about that, is unclear. We think that as these systems are worked through, that cancer patients, because of who they are and because of the vulnerabilities, will be a priority. And we're optimistic that by the spring, that cancer patients will start to get access to it. Our evidence is that it's safe. The latest data as recently as today is that no matter how old you are, no matter what the circumstances you are, that 2 injections of the Pfizer or Moderna vaccine seem to be very safe and effective. And we have every reason to be that it would be effective for patients who have been treated for cancer. And we certainly are going to encourage our staff to get this, and we're going to encourage our patients to do it. And we think it's going to obviously change all of our lives for the better in 2021. We'll get to questions on this, but let me now turn it over to Kim and Kevin to share their updates on our cancer services.
See, could I have the next slide, please? So, Charlie, thank you. And I really appreciate you're sharing the vaccine information, because I think that this is the ray of optimism that is so important for all of us during this time, which continues to be quite challenging. You know, I think as everyone can see in this slide, we dealt with the initial surge of this pandemic back in the spring, when we had a significant number of hospitalizations. This is data from the state of Connecticut, where we had about 1,700 patients, 1,800 patients in the hospital during late April. We had about 450 here in the hospital in New Haven, and much more across the system. We had kind of a brief respite over the summer months, but the tough reality is that we are back in the middle of a second wave, another surge of the pandemic. And the difference now here at Smilow is that, unlike the spring, where we really suspended our clinical operations, we are continuing to provide ongoing access and treatment for cancer patients, both here in New Haven at the Smilow Hospital, as well as all of our care delivery sites across our network. So all of our teams are managing to care for COVID patients in selected, limited areas of the hospital, as well as provide ongoing cancer care, and to do that in the safest possible way. Next slide, please. So I think this volume data is really tells the tale of what our teams have done over the past several months. You know, the orange line is the year 2020. The blue line is the previous year, and you can tell during the midst of the original of the early phase of the pandemic, we had a significant drop in visit volume where patients were staying away from care for a period of time. But we have recovered to full capacity at all, again, at all of our care sites. And we are now continuing to operate at full capacity even through the midst of this second wave of pandemic. And I'm really pleased to say that full capacity operation is across all of our modalities of treatment, including our diagnostic services, our evaluation services, our infusion, surgery, and radiation therapy. And it is really a testament to the resilience and the flexibility of our teams who have adapted to providing clinical care in alternative spaces in a way that we're able to keep our patients as absolutely safe during this challenging time. Kim, I think I'll turn it over to you, I think, for the next slide.
Great, thank you, Kevin. And I really appreciate the opportunity to talk to everyone this evening about the many actions our teams are taking to ensure we are able to continue that safe, high quality care that Kevin mentioned and maintain the safest environment. So I wanted to make sure that all of our patients and community understood that we are still continuing with all of our COVID operations, meaning that we are still performing pre-screening phone calls prior to your visit and then in addition when you arrive at the front door, so that we make sure that if you are having any symptoms that could warrant a COVID test, that we make sure that we make those appropriate arrangements and that the same happens when you arrive for your appointment. We also make sure that we have all the appropriate precautions, including our visitor restrictions. I think for our patients and our teams, this has probably been one of the hardest things we've had to do is limit our visitors, both on our inpatient units and in our ambulatory settings. So we do have exceptions when patients really need to have a loved one with them. For various reasons, we are allowing that, but we really do need to limit visitors as much as absolutely possible to ensure the safety of everyone. And we know that is very difficult. We are trying to use technology to stay connected and to make sure that our patients' families and loved ones have the ability to participate in their care as much as possible. And so if those options are not being offered to you, I would encourage you to talk to your clinical teams about how we can use technology to bring your family members into your care, but we should also be offering that to all of you. We do also, for our cancer patients that are unfortunately experiencing COVID, we do have a program where we are calling all of our COVID positive patients daily to do what we would call wellness assessments on them and making sure that they are feeling okay, that they can stay at home and recover at home as much as possible, but then intervening if needed and making sure they get the access to the care they need in a timely manner. So we are still performing that. In addition, we still have remained to have clinical workflows for our cancer patients with COVID if they need care or if they need to be tested and having symptoms. So we still have our rapid evaluation clinic here at the New Haven campus, and we also have regional designated sites where we can care for our cancer patients who may be experiencing symptoms related to COVID and get appropriate testing. And then also for our cancer patients who are COVID positive who need supportive care or may still be receiving cancer treatment. And we have actually in our rapid evaluation clinic, since it opened in early April, we have had 971 appointments through that clinic. And we're very proud of of offering that to our patients during this time. But as Kevin mentioned, in addition to doing all of those things to keep our patients and our staff safe, we really are continuing our cancer care. And we have put together 4 transformation teams that really focus on everything we've learned through the pandemic on how we're going to leverage innovation to continue to provide excellent cancer care. So we have an inpatient team, an ambulatory team, a supportive care team, and a clinical research team. And not only are these teams working on how we're delivering our care now during the pandemic, but like I said, really innovating on how we're going to care in the future. Also during this time, as Kevin mentioned, we are seeing our second wave of COVID in the state of Connecticut, and we are encouraging that when we can use telehealth, we are using telehealth for our patients. So in cancer care delivery, I know everyone on this forum knows that you need to physically be seen at certain times in your journey, and your treatments need to continue. But there are opportunities where we can provide telehealth services to you at home. We are even starting to do some nursing education televisits, so that this used to be education that we had to provide to our patients in the clinic that we are now piloting and trying through telehealth, as well as your provider visits. We can go on to the next slide. I want to make sure that everyone on this forum knows that while we are limiting certain on-site activities, that we have continued to provide integrative medicine and supportive care virtually. You can go onto the Yale Cancer Center website and you can find our weekly calendar, and you can sign up for all of these virtual offerings. We still have meditation and yoga and our support groups led by our social work team. So I just want to make sure that our cancer patients and their families and loved ones know that we still are trying to ensure that you have access to all the supportive care that you would have had prior to the pandemic. And with that, I will turn it back over to Charlie.
Well, Kevin and Kim, thank you. Our next speaker is Javier Alvarado, who is the leader of social work for our health system. And I think we're so pleased that Javi could make the time to join us, because obviously I think all of us are dealing with some very challenging times, and getting perspectives from somebody like Javi is, I think, vitally important. So Javi, thank you for joining us.
Hi, thank you, Dr. Fuchs, and I'm so happy to be here with all of you tonight. It's fair to say that we are living with a lot of fear and uncertainty, and many of us are sheltering in place to slow the spread of COVID-19. This can make it tough for any one person and family, and now we have upon us the holiday season, which could add to the stress we are all experiencing. Dr. Fuchs mentioned a few reasons for optimism, the vaccine and cancer treatments. And I'm going to talk a little bit about resilience and ways to be optimistic to help us get through some of these challenges. So when we are first diagnosed with an illness, we may experience many emotional reactions, a wide range of feelings that we may not be used to dealing with, feeling overwhelmed, denial, feelings of anger, fear, worry, sadness, depression. And sometimes we even feel like we have to be strong to protect our friends and families. And all of this is normal. It's important to know, however, that there is a lot that we can control. Resilience is a skill that we can all learn. Resilience is the mental, physical, emotional, and behavioral ability to face and cope with adversity, to be able to adapt to change, to recover, and learn and grow from our setbacks. One of the most important resilience skills is our attitude, a positive attitude. It's important to our overall emotional health, and it really Attitude is really the way we think or feel about someone or something. You will find that in many behavioral health or therapy approaches, there is a focus on our thoughts and how our thoughts lead to emotions and how those emotions often lead to our behaviors. Now, it's easy to adopt a positive attitude when life circumstances are generally good and problems are few. But when circumstances drastically change in a negative way, it's not always easy to keep a positive outlook. I understand that, especially when those changes involve ill health. So what are some of the things that we can do? So we all have these conversations in our head. I might be thinking, how am I going to do during this evening's presentation? Or I'm not going to do well. It's important to listen to those conversations that we have. And when you have a negative thought, try to turn it around and make it into a positive thought. What we're really talking about is practicing self-compassion, telling yourself you are doing well, you are doing the best you can, no one is perfect, telling yourself that you are smart, that you're beautiful, that you're funny, that you're kind. Also, it's important, I found it very important to interact with positive people. Now, we all have negative friends or perhaps family members, and I'm not saying that we should disown them, but do your best to surround yourself with positivity. And Kim mentioned some of the support groups that might be available. So some of these health-related support groups would be an opportunity for us to share personal experiences and feelings and coping strategies. Getting pleasure out of the simple things in life, whether it's a walk or time with family or friends, now mostly virtual, slowing down to enjoy these precious moments. Optimism seems to be the theme this evening. So hunting for the good stuff that gets us through each day is also important. It's a skill that helps us create positive emotion by noticing what's good in our lives. This is important because we often tend to focus on what isn't good. In behavioral science, this is called negativity bias. So praise yourself when you have done something well. Receiving praise makes people feel good. Practice this every day. And again, really about self-compassion. The mindfulness, if you've never heard of mindfulness before, it's the practice of being present in the moment. In my experience, present moment awareness helps reduce symptoms of anxiety and depression. When you focus on the present moment, you're paying attention to those things that are currently happening. We can take control of our day, or each of our day, and our outlook rather than focusing on the future in this way. Those who live in the moment tend to be happier, calmer, more relaxed, and appreciative. Sometimes our mind will steal away these precious moments, so don't rush through it. Don't wish it away. Each day we could start positively. When you wake up, decide what your day will look like. What can I do today to take care of myself? How will I practice self-compassion? What can I do to feel more connected and fulfilled today? Now, I've taken meditation courses before, and I remember my very first meditation course, I was told by the instructor that I was not breathing correctly, which I found hard to believe because up to that point, I was still alive and I thought I was breathing well. The purpose of mindful breathing is to anchor yourself in the present moment so that you can let go of worrying. Just taking those moments to focus on your breath it involves becoming aware of your breath and focusing on it. Just the act, again, of focusing usually slows your breathing down, makes you feel more relaxed. So as you focus on how air moves in and out of your lungs, mouth, nose, it becomes a form of calming meditation. And while doing breathing, you can also do mantra breathing, which is the technique of that helps you focus on your breath. A mantra is just a phrase or a word that you repeat to yourself to create focus. And as you repeat it, you become able to relax and meditate. A mantra such as, I deserve happiness, I deserve peace, repeating that over and over again as you breathe, again, helps you focus. Connection is another important factor that affects us all, particularly when we are going through tough times. Connections in our relationships with family, friends, other loved ones, even community connections. Seek them out, spend time around positive and supportive people. And so, these are some of the tips that help build resilience. And while we cannot always be upbeat, and that's perfectly fine. It's again about self-compassion. When you don't have good days, it's fine to accept that and have those moments. The other item I wanted to talk about was the holidays. And this all begins by acknowledging that the holiday season will be different this year. But that's different. That difference can have positive qualities, I think, as well. While many of our gatherings with family and friends will look very different this year, we may be able to create new traditions this holiday season. And for many of us, it will include, this technology and virtual gatherings. Others include things like making online gift or shopping, or very small events with your nuclear family, or maybe even thoughts about making digital photo chronicles of previous holidays. It allows for us to be creative this year. It forces us away from what we usually do this time of year, which is the running around to all the stores and looking for the perfect gift. In many ways, this is going to be a much more personal, much more real holiday than in the past. So all of these changes are in the name of preserving our health and our health of our loved ones. Let's not underestimate the value of old-fashioned cards and letters that we used to send each other in the past. Remembering why we celebrate during the season, what things we ought to be placing importance on, like health and warmth and intimacy, are all important, very important. And as again, focusing on our self-care is important. Doing things that we enjoy, whether it's taking a walk, virtual exercise class, cooking a meal, spending time with our family. For those of our patients and families that are burdened by illness this season, we are encouraging you to accept the help and support that is extended both from your loved ones as well as from other sources. Kim mentioned the Integrative Medicine and that you can find on the Yale Smilow website. There are a number of videos, as Kim mentioned, that a library of videos that talk about a lot of things that I just talked about today. So thank you again and again. Practice a lot of self-compassion and the resilience that we've shown over the last many months, we can continue to show in the many months to come. So thank you.
Well, Javi, thank you. That was a great discussion, and I think incredibly helpful for all of us, most notably our patients. Let me now, I think we're going to turn now to questions. As I say, we've gotten many. Please continue to submit your questions on the Q&A or chat line, and I'll start, and I'll start with a few. So let me actually open first and turn to Nancy. And Nancy, as somebody who's obviously working with a lot of patients in your capacity as a nurse in the melanoma unit, I wondered if you could share with us your perspectives from, from nursing really in the care of patients during these challenging times, what you've encountered, some of the things you would like to share with the several hundred people who are on the line now.
I think it's most important for me to tell everyone how much we care about each and every one of our patients. We have gone through great lengths to make sure the environment is clean and is safe. During the height of the COVID pandemic, we were out of the Smilow Cancer Hospital and relocated to Guilford. We had a young man whose parents did not want him to come into the building, and Dr. Clune and I went out and took stitches out of his person in the back of his mother's car. We are here to do anything we need to. Our team wants to meet every patient at the space they need us to. We're willing to do anything to make everyone comfortable and safe. I think that it's also something that we pride ourselves in here in the cancer hospital, that we put patients first.
Well, Nancy, thank you. That's a great story, and it really speaks to your commitment and those of your colleagues. Paula, as somebody who leads administratively the operations for a number of our care centers that is outside of New Haven, one question that's come in is, are we applying the same rules of safety in those centers that we are in the main campus in New Haven? And, how is that going? And how, tell us about that approach.
Thank you, Charlie. Absolutely. We are employing the same standard for COVID precautions in all our Smilow locations, as well as throughout the entire hospital system. We work very hard. We pre-screen all our patients 24 to 48 hours in advance of their appointment. We also have the unfortunate job of telling our patients about our visitor restrictions, because our staff totally miss our visitors. It's not just the patient who sits in our infusion chair or in the exam room that we have developed relationships with, but it certainly is that caregiver that is providing the care outside of our walls to that patient that we miss just as much. We also are using the standard protective equipment. So we are masking, gowning, hand hygiene. We talk about this every single day in our huddles, every single one of our locations, whether we are at main campus at 20 York Street at North Pavilion or in one of the network sites, has a daily morning huddle that we are discussing any of the new things that we are doing to protect our patients. Our patients arrive at any of our locations and are again screened at the door, and we apologize that we are asking the same questions about your cough and sneezing and runny noses, but we do want to go through every single one of those symptoms because we want to make sure that we're identifying anyone that might have a COVID symptom. And rest assured, your treatment will not be suspended if you do have a COVID symptom. That is what our rapid evaluation clinic is all about. And just this week, we had a patient who presented to the clinic who had one of the COVID symptoms and didn't think that it had anything to do with COVID, but we're able to get her right over to the rapid evaluation clinic. Lisa Alvarado helped us make sure that that happened very quickly. And in fact, she did not have COVID at all and continued on with her treatment. We just want to make sure the safe environment. We've also stepped up our environmental services. So we have a team walking around with the cleaning supplies that we need, are cleaning extra every single doorknob and elevator button that you might press. So we are doing everything we can to keep everyone safe.
And Paula, thank you. And I actually, when you've given me the privilege of a tour, I have to tell you, I walk through with you, and I don't think there's a safer place to be on the planet. So, and I know the patients feel the same when they're there. So thank you.
Thank you, Charlie.
So Dr. Kelsey Martin, who works in Orange. Kelsey, obviously two questions. One, given your expertise in hematology and hematologic malignancies, we actually have a number of patients who have the gamut of malignancies in hematology, lymphoma, chronic myelogenous leukemia, myeloma, all of whom are asking when the vaccine becomes available for COVID. Should they do it? Is it safe? Will they respond? And then wanted to ask you that. And then also any thoughts you have from your experience, from your vantage point, your practice.
Hi, thanks, Charlie. Thank you to everyone. It's really interesting to hear everyone's thoughts tonight. I think that's a really, really important question. And I think we all have the same question. Dr. Anthony Fauci actually just spoke a couple days ago at our ASH meeting, at our American Society of Hematology meeting. And he was promoting the use of, the COVID-19 vaccines for our patients with blood cancers. That being said, I'm not familiar with, and I don't think that, they included any patients who had, compromised immune systems in those studies. So I think it's probably an area that's evolving for our knowledge base. One of the concerns that we sometimes have for our patients with blood cancers is, have any of the treatments they've received, is that going to impact their ability to respond to the vaccine? And I think that's an important question that we're still learning information about. But I hope that it's not a live vaccine, the ones we have available so far. So I hope that they will be available to all our patients safely.
Great, thank you. And then sort of from your perspective, from your work in Orange, any thoughts, things that you've come across that you wanted to share?
Oh yeah, so this has been a fascinating ride, and I think that one of the things that I just wanted to say thank you to all of our patients for their flexibility, because every day I sometimes feels like a new email comes across, or a new rule, or a new visitor restriction, and we have to tell patients things at the last minute, and our patients have handled it with such stride. And as the speakers before me have mentioned, we are here for you, whether we're making a phone call from, or a video visit, or, coming up with some creative alternative of, including patients and family members. We have not stopped, but I really do appreciate everyone's flexibility, because there's a lot of pivots and changes that have happened along the way.
Kelsey, thank you. Dr. Christy Gomez, who works in Torrington. Christy, a number of questions that I could offer, and obviously we want to hear, I also get your perspectives from Torrington, but let me just start. A couple of questions that patients are asking, both for themselves and for their family, about during this challenging time, Christy, what should we be recommending about people going for standard screening, like colonoscopy and mammography and things like that? What advice, is that something we should be recommending or not recommending? What do you think we should suggest to patients and families about this?
Charlie, thank you. This kind of is a beautiful segue into what I wanted to comment on. I want to highlight or recognize or honor for a second the fatigue that comes with a new way of life now, months into this. My oldest niece is in her senior year of high school, and I am trying to challenge her to see that life goes on, that senior year looks different, that we are called to newness or creativity, like Javi mentioned. And so in the same light, life goes on, and our health remains pivotal and must be optimized in order, number one, to continue to be healthy in light of a potential risk of virus and infection, but more that our body, our aging process, our screening anniversaries need to be met, and that safety has been our utmost commitment. I am working closely with the GI team locally, and they have guaranteed the safety of, for instance, endoscopies, annual colonoscopies. At our center in Torrington, we have a local imaging center right next door, and our patients are so appreciative that their breasts exams, their mammograms and ultrasounds are done. I'm seeing a patient, she goes next door and gets the study. Life goes on, and we are asked we're called to continue to show up to all that life is calling us to in utmost safety. And I think everyone is pulling through with that. Our colleagues in GI, in radiology. To me, it's been the utmost important recommendation to my patients. In some instances, when the world stood still in the spring, things were delayed, and unfortunately, we've seen some manifestations of that, or later presentations. So I encourage everyone. I invite you. I hold your hand in saying it is safe to do so, and you are important. Your health is important, so that you meet the challenges of your health and any challenge that you have in these times of sheltering in.
Christy, thank you. That's very helpful. Dr. James Yu from Therapeutic Radiology, Radiation Oncology. We actually have some questions about a number of questions that relate to various radiation approaches. In fact, one question specifically about the role of IMRT for prostate cancer, but and which I think would be great for you to address. But also maybe if you wouldn't mind, James, also sharing some of your thoughts about some of the newer technologies that you and your team are beginning to avail patients as we're moving forward.
Sure. So most of the innovations in radiation over the past couple of years have mainly been in technique and trying to reduce the side effects associated with radiation treatment. The area that I mainly treat, prostate cancer, we've been pioneering the use of something called SpaceOAR hydrogel, which is to space the prostate away from the rectum to reduce side effects to the rectum. We put markers into the prostate to track the motion and really shrink the margins around the prostate when we deliver radiation treatment. But one of the things that's been beneficial based on what we've done at Yale is to shorten radiation treatments. And that is actually, because of the COVID pandemic, really shown a light on how we've focused on trying to make the treatments as convenient for patients as possible, and reducing the number of times that they come in for radiation treatment has been one of the things that is recommended for how to deal with both treating patients properly and minimizing their virus risk. I can speak more about radiation technologies for hours, but I think I'll leave it there.
Great, thank you, James. Kevin Billingsley, as you may have heard, the state of Massachusetts, the governor just announced that they're putting a stop, if not a slowdown, to elective surgeries. Any thoughts about what will happen in this latest surge with regard to surgeries at Smilow?
Charlie, I really appreciate that question, because having lived through the spring when we had to delay so much surgery, it was, I think, it was a source of great stress and anxiety for many patients and families. And as a surgeon myself, I really have great reticence to postpone a patient's operation in the setting of a cancer procedure. I think the good news is that with the tiered approach and the size of our hospital facilities across our network, it gives us incredible flexibility to move patients across inpatient units and separate surgical patients from COVID patients or even patients under investigation. And at this point, we are continuing to do our full operative schedule, and we have no plans to curtail surgical procedures. Now, that being said, we are monitoring infection rates, hospitalization rates, ED utilization rates really on a daily basis. And this pandemic can certainly throw us a curveball, but our aim is to continue unrestricted access to surgical services.
Great, thank you, Kevin. Javi, I think a good question that one of our patients is sharing, that I'm really pleased that they're willing to share this. A patient who talks about her spouse, who doesn't like to talk about the patient's cancer, and I think it sounds like by the story wants to sort of be a brave soul and reassure the spouse, but doesn't really want to talk about it. And I think as she says, he's not in denial, but uncomfortable talking about it. And what would you advise a couple like that?
Yeah, thank you for that question. Yeah, I think it's important to remember that many people have little experience with life-threatening illnesses. They may not know what to say to you or how to act. For some people, it may be frightening to learn that their partner has cancer. Others may have lost a loved one to cancer, and the diagnosis may bring up painful memories. You know, for these reasons, some of your friends and family members may not be able to offer you the support that you expect. And although that may be painful, it's important to remember again that these reactions may reflect past experiences and losses, and not their feelings for you. Some friends and family members may distance themselves, but others you know, will surprise you with emotional and physical support throughout your illness. It's important to have these conversations, to let your husband or your wife know ongoing communications. Sometimes we try to protect our loved ones by withholding information, thinking that that's going to help them. Um, and also with your children, in order for for the children to be able to cope with your cancer diagnosis, it's important to share information. You know, at the end of the day, the more that we communicate and share and even express, I would express to my husband or my wife that they may be having difficulty expressing themselves, that you understand that it's okay, and when they're ready to talk, that you're there to listen.
Thank you. That's very helpful. Nancy, a couple of questions that I think would be relevant to your, one is your area of expertise. One is for patients who are, you know, who are potentially undergoing surgery for, you know, melanoma or any other cancer. Is there any greater risk in terms of what's going on with the pandemic, and are there things they need to be doing differently? Should they delay their surgery? And then also related to your work in melanoma, a common tale is, you know, somebody notices something on their skin, but, you know, do you want to go to the doctor and get it checked out? But at the same time, you're concerned about it. So what do you do? So two questions for you.
Sure. Definitely have it checked out. Dermatology is a big portion of how we operate. If someone goes to their dermatologist and a biopsy is done, they are referred to the melanoma team. It's important to keep track of the moles and discolorations that you may have, especially as one matures. Most of the sun damage that was done in our youth develops, as you know, as we become adults. So I encourage people to please go to the dermatologist. Don't delay that. As far as our surgical setting, because we saw such a dip in March and people did delay treatment and care, we've noticed that some of the areas are larger, deeper, and bigger. So I would hope that people would realize that we are offering a service in a safe environment, and please do not delay care, because the area can change or grow and present other issues that we could head off at an earlier stage if caught earlier.
Thank you, Nancy. Kim, let me ask you, you obviously, I think we've talked a little bit about the visitation policies and on the inpatient side. So what kind of things can we do for patients and their families who are hospitalized, given the fact that we need to take these policies, keep these policies in place to keep everyone safe? So what kind of things can we do to help families through that?
And Charlie, thank you for that question. And again, we're really trying to make sure that we are engaging and providing that support for our patients and their loved ones. So we really are trying to leverage technology. So if our families have the ability to FaceTime, and we can also set up, much similar to this, a Zoom, you know, where even when our providers, when our physicians are rounding and the family member wants to have their loved one involved in that discussion. We can Zoom them in, and the patient doesn't have to have their own smartphone or their own tablet. We have the ability to provide that at certain points in the day for patients who do not have those devices. So we really try very hard to make sure that we have that ability. We can do the good old-fashioned phone call if people don't have the ability to do the video interaction. So we also have that availability. And again, as Javier had mentioned, you know, we do have our social workers available, and our social workers are not just available to our patients, but they are available to our patients and their families and loved ones. So I want to make sure that you know, that patients and families know that we are here to support them. So we just try really hard to engage in any way possible. A lot of times what's helpful, if a patient's going to be admitted, I know sometimes our teams are asking, you know, what would you like? I think setting up that plan ahead of time. Is there someone in particular you want us to give updates to every day? Is there someone that you want to make sure that I'm here when you call them to provide any answers to any of their questions that they have while you're talking to them on the phone or FaceTiming them. So I think there's lots of ways that we are trying to engage. It is hard. Paula talked about this. Nancy talked about this. Our physicians on the line here talked about it. It is something that is just very difficult for all of us because it's something that we find so meaningful in our work. And we want our families involved in the care, and we get a lot of joy out of interacting with our patients, families, and loved ones. So this is very difficult for us as well, and we just want to connect any way we can. So I would also say for any of the patients or family members on the line here, if there are any other suggestions for us on how we can interact with you and how we can engage with you, we would love to hear those as well. So please don't be shy about giving us your thoughts and ideas.
Kim, thank you. Paula, I think a very fair question. How are we screening our employees who are coming to work to make sure that everything is safe in our facilities?
Absolutely. So all our employees are required to self-check their temperatures twice daily, one prior to arriving to work and one after work. We also provided thermometers to those employees who were not able to afford a thermometer. We also had employed during the height of the pandemic temperature check stations throughout all the network care center sites. Anytime an employee during their shift feels the least bit sick, doesn't matter how insignificant, it was a sneeze, a cough, or I'm just starting to get a headache, they're immediately reported to the on-site leader, and they are sent home. And then they call our COVID hotline for instructions. We have very detailed instructions as management team that is from our infection prevention experts at Yale related to exposure guidelines, and we follow those to the T.
Thank you. Dr. Gomez, a question. How does one access genetic testing, genetic counseling, and should all patients undergo genetic testing?
So one of my loves in oncology is that we are really a team, and something like tonight is the way we approach cancer care. And here at Yale, we have a strong genetics counseling team. For me, they're a click away. And part of my assessment of patients is to obtain a very detailed family history that can give clues as to whether there's a familial syndrome that this cancer may have elicited from or pertain or risk to next generation, one's children or grandchildren or siblings as well. So that's number one. We've got a strong genetics team. To me, it's a click away. It's part of my initial and subsequent evaluations of patients. Secondly, the next question is who gets tested, or when does that conversation come up? I have a particular affinity, as you mentioned, or love and interest in GI cancers. And as you are all likely familiar because it was all over the newspaper, New York Times headlines over 2 years ago. Colon cancers are manifesting themselves in younger and younger patients. Patients who have not yet had their first colonoscopy as initially prescribed at age 50. So when we see younger breast cancers, when we see colon cancer in younger individuals, when we see families where there's multiple members with similar or linked tumor types, all of that signals to us these flags, and we begin the discussion of a deeper family history and a referral sometimes just to genetics, even if it's not the classic syndromes, but there's just some key members that should be further looked at and tested. In addition, I have patients who've had multiple cancers throughout their life. And again, they're not syndromes that fall in link or textbook cases of pancreas or breast and ovarian, but that's just the fact that there's multiple cancers in an individual. I think that too warrants a consultation with our genetics team. Once again, a team approach to cancer care.
Great, thank you. Dr. Martin, a question of if someone has been diagnosed with cancer and actually been treated for it, are they at higher risk of getting COVID? And whether they are or they're not, what sort of things should they be doing to ensure that their risk of getting is as low as possible?
Sure, thank you. Was the question that they're on treatment?
No, well, the question is specifically a patient who I guess has completed treatment, but are they at higher risk of getting it? And I guess you could also speak to people who are even on treatment, and what kind of things can they do to minimize their risk of getting it?
Sure. Yeah, that's a great question. So, for our patients with cancer who are, actively undergoing treatment such as, chemotherapy, we do want to take extra precaution for those patients. I think there's a number of things though that we are also aware of, that increase the risk of the severity of COVID, I should also say. Things like more common health conditions, blood pressure and diabetes and obesity. So we often are looking at the total package, so to speak. We would continue to emphasize wearing masks and hand washing and practicing social distancing until, we have, and I just also want to address, I see some of the questions, Dr. Fuchs, in the chat about, the safety of the vaccine in patients with different types of cancers. And, I think just to clarify something I might have said before is, these are not so far the vaccines that you mentioned previously are not, what we call live vaccines. And so if we, compare that to other, non-live vaccines that we used for, previously, I mean, we do use those in patients with cancer. And so I'm optimistic that that's going to be our plan.
Good. Thank you. Dr. Yu, James, two questions. One, a very specific question, which is if you've had radiation after a resection of your prostate for prostate cancer, can you get radiation out of areas? And then another question that's come in is, there's been in the news a notion of proton beam center and proton centers. And, what is that? Who should get it? And is it a good thing?
So thanks for that question. So the first part, you should not get re-irradiated to where the prostate used to be if you got what's called salvage or adjuvant radiation to the prostate bed, because we push the dose up to pretty much the maximum tolerated dose for an area that's been surgically reconnected. But you can get other spots radiated if cancer pops up in another spot. There's a entity called oligometastatic, which is increasingly talked about, but basically means only a few sites of metastatic disease. That's, I would say, so new that you should really have a conversation with your oncologist and your radiation oncologist about whether you qualify for radiation to those oligometastatic sites. If you are having pain in a site, in a bone, then certainly we can radiate in the traditional manner. But sometimes the treatment of oligometastases is a little more aggressive and using a little bit more radiation dose. But it's a conversation you should personalize with your provider. Now, the second question that you asked, Dr. Fuchs, about proton beam. Proton beam is actually a technology that's been around since the 60s, and Mass General was using a huge cyclotron to treat in a kind of a unflexible way, I guess, because of the technology at the time. Since then, the technology has been miniaturized, shaped, and now there's second, third, and fourth generation proton machines. Here in the state of Connecticut, I think we're actively, I mean, it's public record, we're actively seeking to partner and build one of those machines simply because we think it's the right thing to do. I think the benefit of that technology is largely in kids, who you don't want to radiate any tiny amount of tissue unnecessarily. And there may be other benefits for adults as well. Folks with head and neck cancers who require reirradiation, esophageal cancers, certain types of lung cancers, and maybe breast and prostate cancer. But those are a little bit more tricky because we do such a good job already. And so I think Yale is going to approach it in the right way, making it available to our patients while at the same time building up evidence to support its proper use so that we can be good stewards of everybody's healthcare dollars.
Thank you. Nancy, a patient asked, who I guess who had a localized melanoma removed surgically, who's getting exams, lymph node checks, blood work, x-rays, but wants to know what is the latest research concerning getting an early diagnosis of a recurrence of melanoma.
Well, we recommend that if you've had a melanoma that you're followed by a dermatologist every 3 or 6 months. So that would be the first step in catching anything that changed on the surface of the skin. People have actually told us that they see a spot change and they call the dermatologist. So self-examination is most important. Being aware. Now, if it's on your back and you have to have your partner or significant other participate in this, that's important so that there's open lines of communication within the family that keeps an eye on everyone's body surface area. But I think that to go back to what I'm driving at in a very long train here, the sooner we can get this, the sooner we can get it in and biopsied or resected, the better off we all are. Melanoma, as you know, is a sneaky little devil and it can pop up again in other places. So the more we can see it and keep track of it, the better off we are.
Thank you. Javi, a question about access to support groups. You know, what's the step, you know, you alluded to it, but it came in, actually a couple of folks asked about the availability, how do they access it, how does it work in the current scenario of the pandemic, and could you elaborate a little bit on that?
Sure. So thank you, Charlie, for that question. So support groups are really important for a lot of us when we're going through a crisis, and it allows us the opportunity to share similar experiences and talk about the ways that we cope. We have been offering, by way of Smilow social workers, have been offering virtual support groups. Those are available, and probably the best way to access is just to be able to call the hospital and ask for the social work department, and we can connect you to some of those support groups. If you give me just 1 second, I'm going to pull up the phone number that will get folks to the social work department. So the number is 203-688-2195. The number again is 203-688-2195. That's the social work department, and we'd be happy to connect you to a support group, whether it's in the hospital or outside of the community.
Great, thank you. Kelsey, Dr. Martin, you actually mentioned the fact that as I guess the meeting of the American Society of Hematology, where a lot of the latest advancements in the treatment of blood cancers is being discussed as we speak. Anything you want to share in terms of some exciting things that you're seeing from that meeting?
Sure. So firstly, we had so many of our own physicians presenting really up-to-date, amazing research at the meeting. We've got such a strong team here, so I was very proud to see that. I think some of the things that are happening are, expanding use of immunotherapy drugs into our blood cancers is a very exciting area. I think there was a really interesting session talking about the role of what we call our microbiome and the role of, our own bacteria and our how that impacts our health overall and our blood cancers. And new combinations of dizzying numbers of combinations of drugs available. So I think the future is really bright, and I think I'm very proud to see that our own professors and doctors were a big part of the conference.
Thank you. Kevin, Dr. Billingsley, for patients who aren't having any symptoms that relate to COVID, but believe that they may have come in contact with somebody who is positive, what should they do?
If I'm understanding the question correctly, you're asking about patients who have a known exposure who are undergoing treatment.
Or undergoing treatment, but so a patient, a Smilow patient who recognizes they've been near somebody who's positive, but they're not necessarily having symptoms themselves.
For that group of patients, one of the things that is particularly critical is the level of exposure. And if it is where it is particularly difficult is for folks who have an exposure to a family member or a close relative where they have close and sustained exposure. And in those situations, we are dealing with a greater likelihood of transmission. And it's absolutely critical that in those situations, people self-quarantine for a sustained period of time, and we're still saying a full 14 days. Now, what I want people to be mindful of, though, is that even if there is a risk, we still want you to be cared for. And that's where you need to be in contact with your oncology provider's offices. And if necessary, we will see you in the SREC, the Smilow Rapid Evaluation Clinic, where we can evaluate you or care for you in a very safe environment and not risk exposure to other patients.
Thank you. Well, this isn't a question, but Nancy, if you didn't see it, someone actually wrote, not a question, but a shout out to the amazing Nancy, who is a wonderful, compassionate person and lifesaver. So that's high praise and well deserved.
Thank you.
Yeah. So Javi, a question. I mean, some folks, obviously there are folks who live with others, but there are patients we have who actually are single, who live alone. And this is a tough time, whether you're dealing with cancer or not, to be living alone. And what advice do you have for those people?
Thank you. So yeah, it's a tough situation. I think it's important to know that none of us are alone, that the folks on this panel, Smilow Hospital, the social workers, and there are so many other resources that are available to all of us. And at times I understand that we may feel alone, but we are not. There's an opportunity for us to reach out and to be able to connect to resources. And so I encourage folks that are feeling that way to make the call and to reach out, and there is support out there.
Thank you. Let me just say that, and we're gonna try to get to as many questions as possible, but there are a number of questions that a number of our panelists have tried to answer, which is a variety of folks who have been diagnosed with hematologic malignancies, colon cancer, a variety of cancers, asking, is it safe to get the vaccine? Will the vaccine work? let me just say that this is an evolving field. First, the vaccine is safe. As Dr. Martin alluded to, it's not an active virus. It's actually, in some respects, an RNA or something like that that simply expresses the capsid protein, just a protein. So you can't get COVID from the COVID vaccine, and there's reason to believe that the majority of people who get the vaccine will benefit from it. To Dr. Martin's point earlier, the sort of sub-studies, the details on individuals with certain malignancies who underwent a bone marrow transplant, I think that the level of effectiveness still probably needs to be sorted out, but there's every reason to believe that people would benefit from it, and how much remains to be determined. But my guess is when it becomes available in 2021, we're going to recommend that people get it because there's no risk to you in terms of getting COVID. One question that came up is, well, if you've had COVID, should you get the vaccine? And the answer is yes, because apparently the data that came out today from the Pfizer vaccine was there are actually a number of people who had COVID that still got in the trial, and they didn't appreciate they had been exposed to COVID. And there was no increased harm to getting the vaccine, even if you had COVID. And we don't know how long the immunity lasts, so there's no reason you can't get the vaccine. Another question came up, which is, I think this is an optimistic point of view, is that if you get the vaccine, does that mean you don't have to wear a mask? And that's a really interesting question. And believe it or not, it's actually the title of a New York Times article today that I saw. So maybe that person saw the article. And the New York Times, not that they're necessarily the arbiters on this, recommend that, yes, you do have to wear a mask if you get the vaccine. Why? Because what we know is that it is protective for you, but what we don't know whether that stops you from, even if you're asymptomatic, from transmitting it. So for now, when you, and we're all hopefully going to get this vaccine, when you get it, until further instructions come, we're still going to have to wear a mask until everyone says it's safe. So, and I know let me just tell you, there's a lot of great questions about the vaccine, when it's going to be available. And I think what we know is it's safe, 95% effective. And people ask, what does that mean? It means that compared to the people who got the placebo, there was a 95% reduction in their risk of getting COVID. And moreover, the data says that even for the rare individual who got it, their case was far less severe. This is really exciting, and it's really encouraging. So I think that, it offers a lot of hope. I think there's probably as much, any of my colleagues can comment on the vaccine more, because I know so many questions have come in. We're going to learn more, but so far, all the news, including today's, is good. And you can ask your doctor, your nurse, your providers. We will continue to have these forums and keep you informed about the vaccine. And just as soon as we can, we're going to make it available to you. So stay tuned. The cavalry is on its way. But I just wanted to interrupt the flow, just because so many good questions are coming up. And obviously we're committed to making sure that you get access to that. Nancy, maybe because you're on the line, a lot of questions about melanoma that you probably see coming through, some of which relate to immunotherapy. And I as opposed, there's several of them. And so maybe as opposed to covering each one in specifically, maybe you can just give us a thumbnail on, the state of immunotherapy for melanoma and where you see that going.
I see it as a very promising future for us. The anti-PD-1s and all of the newest treatments are amazing. Dr. Olino is using TBAC, which is an injection into the tumors themselves, which has been very promising. Little off-label, but she's had great results with it. So there's a lot of new things on the horizon. And I think when Dr. Arian start of the department, there wasn't as much to offer people. Today, there is a lot to offer someone who has a melanoma. I can't give you specifics right off the top of my head. I get so excited that I get overwhelmed. But there's always new and positive things happening within the department.
Yeah, no, and I think it's so true. I mean, you all have done a really exciting work, and it's obviously changed the landscape and given a lot of patients hope. So thank you.
You're welcome.
James, I saw a question fly by. I don't know if you saw it, about sort of an ultrasound approach for prostate, and maybe you saw the question. I'm sorry, I'm digging through, but maybe.
Yeah, no, I answered it. I'm not aware of HIFU being used, but I do know Dr. Preston Sprenkle and the folks in urology are looking into what's called focal partial gland therapy. I know he's used cryotherapy in the past, and they're working on potentially other techniques. We, I think as a group, largely think of it as in the experimental range and not really a whole gland, a curative treatment, but it's something under investigation. And I would encourage reaching out to one of the urologists here. Dr. Preston Sprenkle comes to mind as somebody who could comment about focal therapy, partial gland treatment, including HIFU for prostate cancer.
Thank you. Kim, there was a question about, whether we're back practicing in Smilow, and maybe you can answer that question directly, but also, given the fact that when there was a surge in April, we had to move off of some floors, and your thoughts about where we're going now.
Sure, Charlie, thank you. So we have most of our care back in their original locations, but there are still some clinics and some of our infusion services that are still in our satellite locations that were originally in the Smilow Cancer Hospital. And that is really due to the number of patients that are the non-cancer patient population at Yale New Haven Hospital. So we are continuing having some of those clinics and some of those infusion services off of the main campus to accommodate the care that we need to provide, not only to COVID patients, but because of the increase in COVID with this second surge, it's other patients requiring hospital care that we're needing to make sure that we have room for on the York Street campus. So that is something that we watch daily. We hope that we have a good plan in place. The hospital has really, and the entire health system has really done a great job in trying to make sure that we are not disrupting services unless absolutely needed. So we do have a strong plan in place as the COVID, as this second wave continues. We have been doing a lot of predictive modeling, and we're really hopeful that that we won't have to do a whole lot of more movement. Again, we're living through something that none of us have ever lived through before. So we never can say never, but we are hopeful that we can continue the way we're delivering our care right now, and that at some point we will return those other services back to the York Street campus and continue with our robust network sites as well. So, we have our eye on the future while we're continuing to manage through this, but we have really, and I think somebody mentioned this before, that we really do appreciate the flexibility. I think it was Dr. Gomez that mentioned this, the flexibility of our patients. They really have gone through a lot with us through this. And there are times where we have to notify patients quickly that things are going to change a little. We are really trying to minimize that as much as possible. And I feel like we're in a pretty good place right now, but we do always have to have a cautious eye.
Great, thank you. Paula, sort of on a related note, given the numbers creeping up again in COVID, any changes you anticipate across the care center network?
Well, certainly we want to make sure that the right visit type is given to the right patient with the right physician at the right time. So we do look at our schedules ahead of time, and there likely will be some patients that will be asked to do a telehealth visit either by phone or video. That is about to change to a new platform, Zoom. So we're hoping that some of the technology glitches that we experienced with the current platform will be eliminated with the Zoom platform. Because we know it's disappointing when you can't see your physician and he or she cannot see you. But again, those will be selected on patients that it's the right type of visit for them. Right now in all the network sites and at the 20 York Street North Pavilion, we're all following very strict social distancing guidelines. So we're flexing our staff in and out of our locations. That includes our support team. So when we have high volumes of social work needs, we're making sure that we're moving someone out in a staff round to move that social worker in so that we can provide our patients everything they need at the site. But I don't anticipate many more changes to our patients other than we're just continue to ask for that patience on our pre-screening and at the door screening. And that we continue to monitor our visitors because we do work in very enclosed spaces and we just want to keep everybody safe.
Thank you, Paula. Kevin, I may have created this confusion when I asked you the question about the governor of Massachusetts slowing down elective surgeries. A couple of questions came up is cancer surgery elective? I mean, is that fall in that bailiwick? So maybe you could clarify that for the audience.
That's not a straightforward question to answer. By strict criteria, much of cancer surgery we would narrowly define as elective, meaning that it is not an acute surgical emergency caused by something such as bleeding or intestinal obstruction. However, as any of us recognize, when you are a patient or family, there is nothing about cancer care or cancer surgery that feels or can be considered elective. So, although that terminology may be applied, I would not say that we on our surgical teams here consider any procedure for cancer truly elective. We would say that is at least urgent.
Thank you. Well, you know, it's just about 8 o'clock, and I think everyone will probably call it quits at this time. But let me just first and foremost thank our extraordinary panel of experts for taking the time to answer questions and share your insights with our audience. We're really pleased. We had an extraordinary turnout this evening, and Renee, correct me if I'm wrong, because the questions came up. This is being recorded, correct?
Yes, we'll post it online tomorrow.
Yeah, so it will be available for folks who weren't able to watch tonight if you want to let people know. But let me just thank everyone, patients and families who took the time to join us. This has been, to say the least, extraordinary times this year. It's hard enough having cancer or caring for somebody you care about who has cancer, and doing that in the midst of what is one of the greatest public health crises in a century. It's pretty tough. But know for sure that we're all here for you. This forum will continue to keep you informed. We're always available as a resource. And let me just say that your courage as patients and families dealing with this, you inspire us. And it's what gives us joy in our work, is to work with all of you. So on that note, this will probably be our last patient family forum for the year before the holidays. So to our panelists, to our patients and families, wish you a safe, healthy holiday season. Really exciting things coming, I think, 2021 with a vaccine and hopefully life back to normal. So a lot to look forward to and for. So thank you everyone, and have a good night.